Good afternoon. I am not a mental health professional, and I'm going to talk about capacity building and our experience and our model of trying to establish new mental health care facilities with the help of the members of the LHE group. We are talking about conflict situation between Palestinians and Israeli people, between the Palestinian Authority and Israel, and as a result there are conflict-related psychopathologies, and there is shortage of mental health professionals, especially in the Palestinian Authority. And to make it a little bit more clear, the Palestinian Authority is not like a sovereign country. The mental health and the general health facilities are not well organized, and the known structure of primary care, secondary care, and tertiary care facilities. And as a result, many actors are playing there. It's representatives of the WHO, the World Health Organization, representatives from other organizations like the USAID or NGOs, and of course the Ministry of Health of the Palestinian Authority, and besides private facilities. And it's not easy to try to help to establish new healthcare facilities while there is no organization between all these and no coordination between all these actors. Most of them are from outside, let's say, and what is unique to our group is that we share the belief, which is the vision of LHE, that we can do things together in this field of the establishment of new healthcare services or to support existing mental health care facilities. And what is unique, as I've started to say, is that we are locals, both Israelis and Palestinians. We are the real actors. We live there together, and we believe that we should do our best to support and to build new mental health facilities. And these activities is based on sharing the vision of LHE by mental health professionals from both sides, and it's sponsored and generously supported by Professor Kafu and Professor Jim Lickman. And thanks to their support, these activities are taking place, and we hope also we will achieve our goals. The form we are trying to promote these ideas are through annual meetings arranged by Professor Lickman and Professor Kafu, and representatives from the three sides, Arab Israeli, Jewish Israeli, and Arab Palestinians from the Palestinian Authority. And we believe that this multilateral structure is really optimal for the promotion of such ideas. And we are talking about 3 levels of capacity building programs. The first one is long-term program in psychopathology. The second one is short-term regular training in special topics. And the third one is special collaborations. We're talking about the Physicians for Human Rights organization, which also plays an important role in the Palestinian Authority and trying to help in such impossible environment. We are talking, in fact, about pilot programs in which we are trying to bridge the formal gaps by non-formal connections. We want to check the implementation of these programs and to learn during the implementation of how to proceed. So we want to try to do an optimal mapping of the needs in this transition period. Transition, we hope someday there will be a sovereign, independent state of Palestine which can do all that is needed to establish an optimal health system and mental health system. So we are trying to deal with the development of primary care in the Palestinian Authority. There is some form of primary care. It's not developed enough, and our plan is to try to support this primary care, which is located there, and trying to do or to support or to build some form of secondary mental health care facilities, whether in the Palestinian Authority or in Israel, and to establish a form of tertiary care facilities based on the development of referral system from the Palestinian Authority to Israel, where there is good tertiary mental health centers. There is such a model, a successful model, but not in this field of mental health. It works in fields like neurosurgery, oncology, hemato-oncology, bone marrow transplantation, and so on. There is a well-established referral system, and we are trying to cooperate with such systems in order to promote and to achieve our goals. Of course, we will try to cooperate with the Minister of Health in the Palestinian Authority and in Israel, but our program is mainly non-formal, but trying to coordinate with all the actors. The short-term program is based on short-term training in special topics. For example, workshops on conflict-related topics like PTSD that will take place in Adolescent Medical Center in Jerusalem, and maybe also in Al-Quds University. And we will use the platform of the public health schools of both universities. The first is Israeli, the second is the Palestinian. And in the last month, the Hebrew University School of Public Health have been recognized as a center for capacity building by the WHO, and we will try to use this recognition to the benefit of our vision. The second level is long-term program in psychotherapy, which is based on clinical and theoretical training and cross-cultural psychotherapy, children with special needs, and the lecturers and trainers are Israeli, Jewish, and Arab. The trainees are Palestinian and Israeli. The place will be Israel and Palestinian Authority, and we will try to use as needed communication technology, because it's not trivial that trainers and trainees can move from one side to the other because of the conflict situation. So if needed, we can use video conference, internet technologies, and so on as needed. And the third level is, let's say, special collaborations and with the activities of the Physicians for Human Rights, trying to promote the delivery of professional help to underserved areas, and to do some special service or research projects related to the conflict, such as ADHD, PTSD, depression, and to try to learn some more about the victims, the families of victims of war and the victims of war, and another topic maybe to try to get some objective information about suicide bombers, their families, the environment, and so on. Thank you.